So when we think about sexuality, I'd like us to think a little bit broader around this concept of the sexual self. And because I think sexuality often gets misunderstood or misconstrued and more focused on just the act of either sex or how somebody's sexual orientation, how they identify in their sexual orientation. So from a sexual self, the way I would define it is how we think about ourselves as sexual beings influences the way we feel about ourselves as sexual beings, which then influences our behavior. And so when we think about how cancer might influence the sexual self, if you're 25 and have had maybe some sexual experiences, but not a lot, maybe struggling with your body image because you're 25 and you just got out of college and you're in your new job and you're trying to get rid of the freshman 15 and just trying to find yourself, and cancer comes into your world, the experiences that you had prior that influence how you think about yourself are really going to influence all the other pieces, how you feel about yourself and the behaviors. So if you come in and you're diagnosed and you had a confidence sense of self, most likely you're going to use skills that you had to adapt and flex some of the challenges that your body's going to face that we'll talk about in a moment related to cancer. If you've had some negative experiences in your life, if you're 25 and have had experienced a sexual assault or had other negative experiences struggling with body image, the diagnosis of cancer is really probably going to more severely and significantly affect the sexual self because of the way they think about their bodies. I think it's important to point out that our most important sex organ is our mind. And so how we think and what we think is really powerful in how the rest of our body follows suit. And so when we think about how cancer itself, the diagnosis, affects sexuality or the sexual self, a cancer diagnosis is a traumatic experience regardless of your age. You could be 25, you could be 75, and it's scary. When you're 25, you have a lot of unknown already in your life. When you're 75, you've lived through more. So again, probably have more adapting skills and have had to adapt some of your sexual choices, sexual preferences, sexual behaviors due to age and other lifestyle changes. When you're 25 or 26, not so much. You haven't been challenged with that as many times. So when the diagnosis comes in, how you receive that information is often influenced by life, socioeconomic resources, your own experiences, and then the information about the cancer. A diagnosis of a cancer of a sex organ is going to have immediate consequences to sexual function. For a young man with testicular cancer, certainly we know that there might be body image issues. There can be changes in erectile function, not forever, but immediately, and sometimes that's really just based on their own view of self. If their hormones have been affected, that certainly needs to be addressed with hormone therapy so that they can more fully function sexually in ways that are meaningful to them. And if you're a young woman diagnosed with breast cancer or ovarian cancer or cervical cancer, or you're an older woman diagnosed with breast cancer, cervical, ovarian, or vulva, or again, any of the sex organ cancers, the impact on both the view of one's body, because it is so much tied into how society views sexuality, as well as sexual function, right? Our breasts have a lot of sensations and are part of sexual play, and when lumpectomy or mastectomy occurs, it can influence nerve endings and or remove sensations. With cervical or gynecological cancers, any kind of gynecological surgery is going to influence a woman's sexual function. It could decrease their orgasm. It may make it uncomfortable or impossible for them to have intercourse with a toy or a penis. It may make it not as sensual, or they may not have as many sensations with their clitoris or vulva, again, depending on the type of cancer. And so those cancers have direct impact on sexual function. When we think about the other cancers, colorectal cancer, head and neck cancer, blood cancers, and the many, many more cancers, They're usually influenced more by sometimes surgery. A colorectal surgery can affect a woman's sexual function and a man's sexual function. But a lot of times it's the chemotherapy or radiation that they receive that has the longer impact on scar tissue or hormone deprivation or chronic fatigue or chronic dry mouth, smells being affected. And we don't often talk about how, somebody's sensory or smells being affected would influence the way they view their sexual body. But if you have a trach, for example, and there is an odor from that you can't help, there may be a sense of self-consciousness about that. There may be, they may have a sense of needing to withdraw or constantly double check, and that chronic conditioning in their head around thinking about this trait can be really overwhelming for them. So things like dry mouth, we don't think about as well related to sexual side effects. When you have dry mouth from chemotherapy, or if you've been radiated in your mouth or neck, dry mouth is very uncomfortable when you're trying to kiss someone. Or when you're worried about bad breath. So simple things that often are common side effects that we kind of brush over when we're talking about side effects from cancer treatments have direct and indirect impact on sexual function.